And new tonight at 11, the number of confirmed COVID-19 cases just passed the 2 million mark worldwide tonight. This is according to the Johns Hopkins tally. Andrea joining us live from home tonight. We have a lot to get to tonight, Andrea. We want to begin, though, with the three big headlines across the nation. The Trump administration now looking to delay this year's census until October 31st. Health experts believe we're nearing the peak of the coronavirus right now. And the president's task force now trying to figure out how to reopen the country. Some governors are taking matters into their own hands tonight. In the East Coast, governors in New Jersey, New York, Connecticut, Pennsylvania, Rhode Island, and Massachusetts tonight working on a regional plan. Meantime, governors in California, Washington, and Oregon doing something similar on the West Coast.
Well, our state's current stay-at-home order could actually have unintended and even some dangerous consequences for people who are in abusive relationships. In fact, a brand new study from IUPUI shows the number of domestic violence calls actually increased from an average of 73 calls per day to 89 calls once everything began to shut down under COVID-19 restrictions. Now, take a look at this. In just the last 5 days, we've seen two dangerous domestic violence situations here at home, one of which killed IMPD officer Breanne Leaf. The other took place earlier today in Greenwood, sending a 55-year-old woman to the hospital. We understand she's now in critical condition. Tonight at 11 o'clock, our own Emily Longnecker shares the statewide effort now to connect people in unsafe conditions with resources that could actually save their lives.
Non-essential businesses may have shut down, but the phone lines taking calls from victims of domestic violence haven't. The Julian Center, an emergency shelter for victims, is busier than ever.
It's kind of bubbling over, and it's becoming more violent.
In the past 3 weeks, the shelter has received 700 calls for help from people needing to escape an abuser. That number is up 25% more than usual. The calls from people who may be forced to be around their abuser more because of the stay-at-home order.
It's a recipe for disaster because this in and of itself enters in a whole other layer of stress and anxiety.
Leaving, though, say those who work with victims, has become even harder because there's no window of opportunity to get away if someone's abuser is always there.
Statistically speaking, when a survivor leaves is the most dangerous time for them. And we have to be cognizant of that, particularly now, because there's not an easy way to leave. There's not an easy answer.
That's not the only complication due to COVID-19. For the past 2 weeks, the Julian Center couldn't take new clients while they sanitized the shelter and made adjustments to allow for social distancing inside for survivors already there. Some area hotels have stepped in the meantime, so victims had a place to go. Coburn Place, which usually provides longer-term housing for domestic violence survivors, has also stepped in the gap for emergency services.
We've been nonstop. The demand for our services at Coburn Place has doubled within the last 30 days. It continues, to increase.
So does the isolation for victims trying to get away at a time when no one is going anywhere.
So that feeling of walking on eggshells that a victim will have is constant right now.
Both the Julian Center and Coburn Place want domestic violence victims to know there's still help.
We're still here. We're still accessible.
There's somewhere to go, and absolutely please call.
Emily, thank you. Now, beginning tomorrow, the Julian Center will reopen to accept people who are desperately in need directly at the facility. So if you or someone you know is in need of help, we have the numbers that you can call right now. They're on your screen. Also, we're going to post this information for you. If you've missed it, just go to our website at WTHR.com/coronavirus.
I want to give you a snapshot of where Indiana is tonight in terms of COVID-19. We've seen over 8,200 confirmed cases and 350 deaths. Let's talk about the expected surge to come to our state. State health leaders' predictions are a little bit different than the national ones. The Institute for Health Metrics and Evaluations predicted we'd actually see the peak in Indiana today, but the health commissioner said today most of our state probably won't peak until the first or second week of May, saying the peak here in Marion County is expected during the last week of April. Now I want to focus in on our hardest hit county, which is Marion County. We've had more than 3,000 cases, 123 deaths here in Marion County. In Hamilton County, we've had 24 deaths. In Johnson County, we've had 20. And in the coming days, we're going to hear more about how many Hoosiers have actually recovered from coronavirus. On Friday, Governor Holcomb is set to announce tweaks to our current stay-at-home order. That's set to expire on Monday. We're expecting the governor to extend that for another couple weeks.